lot of times cancers are accidental.
Patient might not be obese, they might not have a history of smoking or alcohol intake, but they still develop cancer. It's very important to get a clinical genetics consultation done. One reason perhaps for cancer, smoking, alcohol, obesity problem. I think these are some variables which are present all over the planet.
What is the most common form of cancer in India across all genders? What are some basic differences in terms of the healthcare that you've noticed in the US versus in India?
I do feel systems in India and USA move quite in parallel.
Let's say somebody in Punjab has been diagnosed with stage 4 cancer. Would you recommend they get their treatment in Punjab?
I think it's good to get a consultation again from one of these established cancer centers.
There are some signs we should not ignore them. What are those signs?
Perhaps any sudden weight loss in anyone. I think it's important to keep an eye out for that. Cancer is not only the reason behind that, but that could be one factor associated with it.
Does it ever happen that somebody comes in with zero symptoms and eventually gets detected with cancer? What about microwave?
Microwaves are okay to use.
Vaping?
Perhaps less likely, but long-term data is awaited.
One last thing that I want to talk about is the role that mindset plays in treatment. Cancer is one of the most feared words in the world. But how much of what we know about cancer is actually true, and how much of it is just misinformation, fear, or outdated thinking? Today we sit with Dr. Rohit Mehra on ScoopOut with Khyati. He's a pathologist who hails from Punjab but is now practicing in the US. Let's try and understand the future of cancer treatment and also honestly talk about a disease that most of us fear more than death itself. So welcome to Scoop Out with Khyati, Dr. Rohit. But before we talk about some very important things that we want to talk about today, I want to start with understanding your background. I want the users to understand, the viewers to understand what you've studied. So you've studied anatomic pathology, is that right? What does that mean to a layman?
And that is correct. And first of all, and very importantly, thank you to you and Rakeshji and True Scoop for this invitation. I'm very happy to be here and being able to share what I can. So thanks again for the invitation. Yeah, anatomic pathology. I mean, I think that's a great question because that is what my life is like involved in or dedicated towards. So this is a discipline within science and medicine, which deals with how disease develops, and then what happens to different organ system when diseases develop, and how do different diseases affect the organ systems. And then what changes can we see within those organs as a result of these diseases? And then how do we recognize those changes, both at the tissue level, at the cellular level, at the molecular level, which includes changes in like content and type of DNA, RNA, protein. So all of these falls under anatomic pathology currently. And a big subset of anatomic pathology involves examining tissues under the microscope. And then we correlate that with molecular findings at the DNA, RNA, protein level. Then we correlate those with a clinical condition the patient has. And then we try to essentially put together the clinical pathologic spectrum. So that is what is the essentially the principles behind and the scope of anatomic pathology.
Right. And a big part of what you're doing also involves studying cancer, right?
Correct.
It's just a subset of it, though. There are other things, other diseases that you're studying as well.
That is true, and that is true, and that's a very insightful question. I think majority of what we do is oncology related in terms of like uh, for any or amongst the oncology team which caters to or attends any patient. I am a member of that team whose job is to diagnose cancer, to tell like what kind of cancer a patient has, then how aggressive that cancer is, and then how much has the cancer spread from evaluation of the tissues. But you're absolutely right. Apart from cancer, which is still the majority of what we do, there are non-oncologic processes which we will also study. For example, we can look at some chronic infections patients have. We can look at some immunosuppressive disorders patients have, or immune-related conditions patients have. So broadly, the field gets divided into oncology, which is cancer-related, and non-oncologic processes.
All right, all right. And there's so many things that we want to understand, including the causes, the symptoms, and the fact that cancer has risen so much, especially in India, in the past few years, I would say. Like when we were young, I remember cancer was very rare. And cut to now I think most households are affected by it. So I would like to understand, according to you, what is the number one cause that has caused the rise in cancer, especially in India?
Yeah, I mean, I think this is a it's a good question. I wish I had a single straightforward answer, but I feel it's a combination of different factors. One factor is I do believe, which actually I believe I'm also proud of, is a better recognition of the cancer state. I think previously perhaps patients were not getting diagnosed either quickly or accurately. And I think the better we can diagnose patients, especially through screening conditions,
Hmm.
uh, the earlier we catch on this cancer disease. So I think one reason perhaps for the increased number of cases we see is
Hmm.
awareness,
Awareness also.
what public has, or what even the physicians have. Like physicians are better equipped now in the last perhaps
Hmm.
decade or decade and a half. So I think believe that is at least one reason.
Hmm.
In terms of actual causation, what might lead to increase in association with cancer, I believe, and I think this is just not restricted to India. This is probably all over the globe. Like factors like smoking,
Hmm.
alcohol,
Hmm.
obesity problem. I think these are some variables which are present all over the planet. I think there are pockets in which some of these variables perhaps influence the disease state differently. That there might be parts of USA perhaps where smoking is a bigger problem,
Hmm.
or parts of India where perhaps obesity is a bigger problem, or
Hmm.
vice versa. But I would say at least the top factors which come to my mind is like, I think, unfortunately, an increase in these practices like smoking, consumption of alcohol in different forms,
Hmm.
as well as obesity.
Hmm. But one thing I heard, so somebody in my family had gotten affected with cancer, and when they went to the hospital, like when they were trying to understand what went wrong and stuff like that, one thing the doctor said was a lot of times cancers are accidental. They are not about your lifestyle. They're not about anything. For example, somebody who doesn't drink at all will get liver cancer. How many times, like in terms of percentage, if you can help us understand how often is it that cancer is accidental versus how often is it caused by our lifestyle?
Yep. No, that's a very good question, and I feel we need better studies to very accurately answer that question. And I think there are trends, but I'm still not aware of like very well studies which I could cite, which have really looked at this problem. Because I think this is a little bit more also a problem related to population genetics. And I think it's a it's a tough incidence prevalence question to conquer or to address. But I think you're absolutely right, and I'm sorry to hear about your family members. But I think there are cases definitely where there is like no essentially recognizable,
Hmm.
um, perhaps a background for setting up a stage for cancer. Like patient might not be obese, they might not have a history
Hmm.
of smoking
Hmm.
or alcohol intake, but they still develop cancer.
Hmm.
We do not understand entirely,
Hmm.
but we do know that at least a subset of such cases might be related to the patient's genetics.
Okay.
Like there could be some inherited component, or it's possible patient has a family history
Hmm.
and then they're developing these, or sometimes it can be de novo. De novo means like a patient might acquire it on his or her own, this
Hmm.
cancer,
Hmm.
but it could still be an inherited form of disease, meaning it can also influence other family members or the patient's kids in the
Hmm.
future. So I think that
Hmm.
is something
Hmm.
important to recognize. But you're right,
Hmm.
not every patient will have recognizable forms of the sort of the factors which can set the stage for developing
Hmm.
this condition.
And is there any research going on that is trying to like change, like stop that genetics right there, and so it doesn't get passed on to the next generations?
Yeah. I think no. There is. Can we stop it? I think that is like a very good goal.
Hmm.
I do not think medicine or science is there yet.
Hmm.
Can we catch it early and prevent
Hmm.
the disease from happening in patients' family or their children? We have made very good progress in that.
Hmm.
Like one thing I always tell is that, like for any patient, I think it's important to recognize or check how many of their family members have developed this cancer or this disease or this malignancy. If anyone's family has uh, occurrence of cancer like repeatedly or frequently among different family members, it's very important to get a clinical genetics consultation done. And we have now these family/genetics clinics all across the world, including in India. And I think, and they can draw a family tree and figure out that does the patient's family, including the patient, have a general susceptibility which is related to some inherited disorder, which might increase the predisposition for cancer. So I think looking at within our families becomes very important for cancer patients.
What are some signs that we need to catch early on if we don't want to kind of go down that road too late? If there are some signs, we should not ignore them. What are those signs for cancer?
Yeah, I mean, that's a good question. One, I would say, is like perhaps any sudden weight loss in anyone. I think in any individual, I think it's important to keep an eye out for that. Cancer is not only the reason behind that, but that could be one factor associated with it. Then again, if someone is noting repeated occurrences or frequent occurrences of cancer within anyone's family members, I think it's important to go to the doctor, even if we don't have cancer ourselves, and just get a consultation that, okay, 3 of my 8 family members have developed carcinoma or malignancy in the last 5 years. Is there anything I need to do? And we have now investigations and tests which can help answer that question, and they are available all over the globe, including in India.
So what does the testing phase look like? Let's say I am seeing some symptoms, I go to a doctor, what are the first few level of tests that they recommend?
Um, so it depends on what kind of symptoms one has, and that really influences what kind of testing or interrogation which needs to be done. For example, we can do a lot of blood-based tests. Then we can do a lot of imaging these days, which could be like from anything from X-rays or CTs or MRIs or specialized forms of imaging which are all available. And then if there is a tumefactive lesion, meaning that there is a mass forming there's a mass forming lesion or a mass formation in the body, we are
Like a
all
lump is what we
like a
call it in
lump,
a
like a
term.
lump or a
Yeah.
mass, and
Yeah.
then we are also able to now take tissue from that lump in different forms, and then we can do a lot of tests on that, which includes evaluation under the microscope. We can also do molecular analysis to see if that indeed is some tumor, what is the changes in the DNA, RNA, or protein of that tumor. Apart from this, then there are, if and once a cancer diagnosis gets established, depending on what kind of cancer it is, then I think individual tests start getting stratified based on what kind of tumor does a patient have.
Okay. Makes sense. And the biopsy is what they call it in India, is what you're talking about, studying it under the
That is
microscope.
correct. And we
Okay.
call the same it all over the globe. So I think we are able to take some tissue. We have special processing techniques,
Right.
and then we are able to prepare slides from that tissue, and we place it under the microscope. And then there's a full science or division of medicine where physicians get trained as pathologists, and that is what I am. And then we look under the microscope to see the cellular changes of disease, and that lets us help diagnose cancer.
Does it ever happen that somebody comes in with zero symptoms and eventually gets detected with
Yeah,
cancer?
that's a good question, and I think, and it's a very smart question and a good observation. So this is a little bit dependent on what kind of screening practices we have in a particular country. Like I practice in the USA, and we have like very strong screening protocols. For example, we have screening for prostate cancer, breast cancer, colorectal carcinoma, which is kind of a GI cancer, and when there are screening protocols, actually, more commonly, patients will not have any symptom. But because of the screening for carcinoma, that we want to pick up the cancer early, we are able to detect this cancer even before the patients have symptoms. So these screening protocols can be very helpful in that fashion. But the screening protocols can be variable across countries, but USA, where I practice, and I also believe a lot of segments of Europe, I think there are well-developed screening guidelines now.
And do you think in India also we need those guidelines in terms of like making it a practice?
Yeah, again, it is tough to generalize, and I
Mm.
think, but that's a little bit dependent also on what is the incidence of a particular carcinoma. For example, prostate cancer is relatively common in males or in
Hmm.
men in
Hmm.
USA. So I think it makes a lot of sense from a certain perspective or in a certain
Hmm.
context to carry out screening. So I think
Hmm.
we will have to essentially look at these such kind of trends
Hmm.
in India as well. For example,
Hmm.
in India, I mean, I think like you may know, in males, like oral cavity carcinoma is
Yes.
common because of different practices. In
Yes.
women, breast cancer is common.
Very common.
So
Yeah.
I think, like for example, I know that screening practices are getting established or already
Hmm.
established for breast cancer in
Hmm.
women in India.
Hmm.
So I think there is a lot of work going on.
What is the most common form of cancer in India across all genders?
Um, I do not know across the entire population because we generally tend to look at demographics from a male and female perspective. But I believe in males, oral cavity carcinoma. I believe stomach cancer in males in India.
Hmm.
Also lung carcinoma, and then I think in women, I think breast cancer, ovarian carcinoma,
Hmm.
cervical cancer. I believe these are the ones which cross my mind.
Hmm.
Like I think. Which are getting enriched in the Indian
And
population.
when you say carcinoma, that also means cancer, but in a scientific
That
way.
is correct. That is correct.
Okay.
So yes, that is correct.
Hmm.
Carcinoma is a little bit more of a more scientific terminology
Okay.
we utilize, but it sort of almost equates to cancer.
Interchangeably used
Almost,
to
almost,
almost.
almost.
Okay. Makes sense. And when we're talking about different forms of cancer, what is the rarest form of cancer that, scientists or doctors have ever seen?
Yeah, that's a good question. I think uh, I do not know from the top of my head what is the rarest form of cancer, but I believe there are some organ systems where cancer does not develop or tumors do not develop as frequently. For example, heart.
Hmm.
I think heart is one organ system in which tumors don't develop that frequently. We do see tumors, but not as frequently what we might
Yeah,
see
we've
in
rarely heard somebody
exactly,
has a heart
exactly,
cancer.
exactly,
That's not
exactly,
common.
exactly.
Right. So heart would be one of
Heart would be
them.
one organ system where tumors do not develop as
Any
frequently.
other organs that you have in mind?
I think that is what I can think of. But I also I do this on a daily basis, so I do see a lot of rare and complex and uncommon diseases or tumors or cancers.
Hmm.
But heart is the one which strikes me right now.
Right, fair. And again, talking about the most, I don't want to use the word, but deadly form of cancer, wherein if you find out that you have this form of cancer, the chances of survival are very rare.
Yeah, and I think there are forms of disease which can be more challenging.
Hmm.
It also depends on what kind of tumor it is and how far advanced it is in terms of it is spread in the human body
Hmm.
and how aggressive form of a particular cancer it might be. For example, most patients with prostate cancer tend to do well, but there are a subset of prostate cancer patients, perhaps 10 to 15%, regardless of treatment, they might not fare well.
Hmm.
Then, similarly, there can be other subsets of cancers within other organ systems where patients might have a more aggressive clinical outcome. But the good news is in general, we are able to offer some sort of management or some sort of therapeutic possibility for a lot of patients these days, even the
Hmm.
ones who have aggressive forms of cancer. I think medicine and science has made very good advancement in the last perhaps decade or so.
Hmm. Is there any particular one that's most painful in terms of treatment if you.
Yeah, I think some cancers, for example, pancreatic cancer can be by virtue of its location. I think
Hmm.
it can be more painful.
Hmm.
It can be a more painful experience. But thankfully, there are novel therapeutics now, even for patients who have pancreatic cancer. So I
Hmm.
think I still believe there's a lot of hope for patients these
Hmm.
days.
What about blood cancer? I've heard that if
Yes, yes. So I think generally by what we need by blood cancer is generally leukemias and
Yeah,
lymphomas,
yeah,
and generally they are tumors which affect the blood and the bone marrow organ
right,
systems.
right.
I think again, I think there while they can be definitely a painful experience, but a lot of advancements have happened. That is not my primary field.
Hmm.
I deal
Hmm.
more with like genitourinary
Yes,
diseases,
yes.
but still, from what I hear from my colleagues, is that I think there are considerable advances in
Hmm.
those as well.
You said the reason why cases in cancer have risen over time is also because of awareness. More people are aware, they're getting tests done. Do you think survival rates are also increasing or getting better with the advancement in the treatment that's happening?
I know that's a very insightful question. It's a little bit more organ system specific.
Hmm.
In general, survival rates are better because of earlier detection, better management, better understanding of disease, better therapeutics which are possible, including surgery, chemotherapy. Now we have another form of therapy, which is immunotherapy, which has come up, which can be life-saving for a lot of different kinds of tumors in the human body.
Can we talk about immunotherapy for a minute? Because it's a new concept, it's not something that people are
Right,
aware
right,
of.
right, right, right. Yeah, I think in terms of immunotherapy, there are some organ systems or some types of tumors where immunotherapy is now playing an immense role. For example,
Hmm.
patients can develop tumors in the kidney. For
Hmm.
example, there's a kind of a cancer called clear cell renal cell carcinoma, which is the commonest kind of kidney cancer in adult patients. And once that cancer becomes advanced, which happens in a subset of cases, not majority, once the cancer becomes advanced or metastatic, meaning it spreads into the body,
Hmm.
I think immunotherapy can be very helpful in treatment of those patients. And in immunotherapy, we are able to modulate the body's immune system to
Hmm.
help us fight the cancer, like speaking very in like very lay terms.
Okay.
And that is the power of this. That's the power of this kind of therapy. And
So medicine isn't fighting cancer, the body itself, the immune system of the body itself is
so
fighting
yeah,
that cancer.
so the therapy we give actually retrains the immune system in a certain way
Hmm.
to help it fight the tumor cells. So
Hmm.
that is like stating it like very, very simply. So I think, and that is what these medicines try to do.
And do you think the chances of revival of the cancer cell is also less if immunotherapy is done in?
Yeah, yeah. I mean, I think it depends on the kind of cancer,
Yeah.
and not every cancer is immune therapy sensitive,
Okay.
but the ones where they are, I think it can be very helpful for patients.
Okay.
Having said that, like nothing is perfect, and so is like so are the immune modulators or immuno-oncology drugs, because a subset of patients can have side effects, but overall, I feel in the right context, they can be very helpful.
Okay. And if you're getting immunotherapy done, then you don't need to get chemotherapy or radiation, or they're still a part of the process.
They can still be a part of the process.
Okay.
So a lot of it depends on, generally patients can get multimodality therapy,
Okay.
and some patients might get only immune therapy, but for
Hmm.
others, depending on the kind of tumor
Stage
they have
also.
and the stage, you're
Yeah.
absolutely right,
Yeah.
there might be a combination of therapies.
Right. And what is the typical order in terms of chemo, radiation, and then surgery? I think in some cases it's not just required, in
Correct,
some
correct.
cases
Again,
it
it's
is.
individual. You're right. You're
Yes.
absolutely right. Depends on the patient,
Yeah.
depends on the tumor, depends on the stage, the grade. But I
Hmm.
think these are excellent questions. But in the end, it gets tailored for each
Each
individual,
person.
each person.
So there's no chemo and then radiation. It can depend. Radiation can also happen
Correct.
first and then
Yes,
chemo.
yes. It just depends on the kind of tumor. I think that's a little bit tough to generalize.
Okay.
One thing, if I may share in that realm, is the concept of targeted therapy. I talked about molecular aspect of cancer, where we can look at changes within DNA, RNA, and at the protein level within cells which form a tumor.
Hmm.
And what happens is when these changes develop within a tumor, sometimes this change can make a cell vulnerable or amenable
Hmm.
to a specific therapy which can target this particular change which has happened at the DNA or RNA level.
Hmm.
And this is what is known as tailored therapeutic practice for
Hmm.
oncology, that we are able to tailor or specifically deliver a medicine
Hmm.
for a specific change which happened in a patient's cell. Uh, and and if we find a change like that, and there is a drug which exists like that, it can be miraculous for the patient. And actually, quite a few number of patients now have these kind of changes. And there's a technology, it's called clinical next generation sequencing, where we use this technology to be able to study or identify the changes at the DNA, RNA, and or protein level, to be able to find out what changes are these, and then try to match these changes to the available therapeutic drugs which are available currently. Also, identification of such changes can be very helpful for enrollment in clinical trials for patients. Like there are a lot of medicines which are currently being investigated under clinical trials for patients, and that is how we test medicines for cancer patients. And once the clinical trials are successful, that is how these medicines eventually get released for use for any patient who might have that kind of cancer. And now we have these tailored therapeutics where a specific genetic defect in a patient's tumor can be tailored to a specific therapy. And that can be really life-saving for such patients.
But I think the technique you're talking about must be very expensive and not something that a middle class person can afford.
Actually, that used to be in the past, but now the cost of next generation sequencing has gone down tremendously. And even a lot of centers in India, including the tertiary centers over here, which are catering to cancer patients within India, they have clinical next generation sequencing technology. And I like through my collaborators who are either oncologists or pathologists or cancer researchers within India, a lot of them are actually using this technology on a daily basis.
Can you name a few good trusted ones that people can actually go to?
Yeah. I think it's tricky to take names because there are so many. Because I might leave out some good names, but I believe, in general, I believe that there are a lot of tertiary academic centers, or even in the community setting, or even in the private setting, where good oncologic care can be provided for patients in India. And most of these have care which is at par with any other good center in the entire world. And then they will also have these kind of testing which are available. For example, there is a network of like AIMS institutes all across India. I think they do a fantastic job. One name which easily comes to mind is Tata Memorial Center in Mumbai. I think they do a phenomenal job. And then there are so many. So I think, for sake of time, I don't think I can take more names. But there are also like some very good, even some private cancer centers which provide phenomenal care in India to such patients. And they're also aware of this technology. This technology has been there for some time now. And physicians who are handling or managing the cancer patients, they are aware of such technologies to be able to order for such patients.
Right. Can we also talk about Punjab in specific? Because a lot of our users are from Punjab. And do you think, in terms of treatment, we are matching up to the levels that maybe India or eventually the US also is achieving? Or do you think there's a long way to go?
No, it's a good question. I think it's also a tricky question. I feel cancer disease is a complex condition for any patient. Until there is a right infrastructure to handle that patient and their disease status. And I think it is okay to get care in such places where that infrastructure exists, which includes personnel, which includes physicians, which includes other staff. I think there's like any oncology patient could have probably a team of anywhere from 5 to 15 people, or folks with different expertise which can come towards handling a certain patient. For example, there might be clinical geneticists involved, there might be a nutritionist involved, there might be a medical oncologist, surgical oncologist, radiation oncologist, a pathologist involved. So I mean, I think so. Actually, it is definitely a complex network. Uh, is this kind of network available everywhere in every hospital? No, and we also don't expect it to be, because every hospital has its own niche. I think we probably tertiary centers are generally the best bet, and I believe some of these exist in Punjab as well, and I know some others are coming up.
So, what is the best hospital in Punjab for cancer treatment?
Again, I think so. I don't get into controversy. And I think that's a broad question, and there are a lot of parameters to look at to compare across hospitals. And a lot of hospitals tend to do a lot of things very well. But again, I feel that the tertiary centers where such infrastructure exists to handle cancer patients, I think the tertiary centers in Punjab, I think, are the good places for patients to
What
go.
does tertiary center exactly mean?
Yeah, tertiary center. Yeah, that's a good question. Tertiary center is like where there is an integrated system available under the same roof, where the patient can get a diagnosis of cancer, where patient can get the appropriate management, where perhaps patient can be considered for enrollment into clinical trials. For example, there might be an experimental medicine which is available, but it is not available or approved for general use yet. But patient could get enrolled for clinical trials. Also, sometimes patients who have cancer, they can develop complications, and such tertiary centers have the environment or the infrastructure in a multidisciplinary setting, meaning that there are different kinds of expertise and physicians available who can handle such complexity. So in general, that is what we mean by tertiary center.
One thing that's happening in India a lot is commercialization when it comes to the field of medicine and hospitals. Um, do you think like the big chains, I'm not going to take any names here again, are somewhere getting more profit driven than value driven in India?
Um, that's an interesting question. I honestly do not know the answer to that, and I have not looked at it from that perspective. Is there a business case of medicine? I guess that exists all across the globe because any business has also to be in a positive state of funds to be able to deliver good care. So I think it's a two-edged sword, I guess so. But I honestly do not know the answer to that question.
Right. And you've been practicing in the US for quite some time now. What are some basic differences in terms of the healthcare that you've noticed in the US versus in India?
Yes, I know. I think that that's a good question because I have probably looked at both sides of the coin. I think I do feel systems in India and USA move quite in parallel, which I really like that system. And I like the fact that the practices or the principles behind medical practices, oncology practices are relatively similar. In USA, the infrastructure to look at uncommon conditions, uncommon tumors, and for advanced testing can be very strong. I feel in India, what we tend to do very well over here is having multiple practices under the same roof and then also delivering healthcare in a very urgent fashion. I think India does that remarkably well. And I think that is very tough to beat here. I think there are a lot of systems across the world where that urgency in delivering healthcare can be lacking. And I think the health system in India, including the physicians, as well as the even probably the government initiatives behind delivering that kind of care are like very strong.
Let's say somebody in Punjab has been diagnosed with stage 4 cancer. Would you recommend they get their treatment in Punjab, maybe somewhere in Delhi or in the US?
Yeah, no, that's a very good question. I do actually get asked that question quite a bit. Like, and I do travel internationally for different reasons, including to talk at conferences and meetings. And I do get asked this question quite a bit, even in India. I feel that for any patient who has either advanced disease or treatment refractory, meaning that the patient is not responding very well to treatment, I think it's good to get a consultation again from one of these established cancer centers. And they might be in India or they might be somewhere abroad. But I think till the patient and the patient's family get a consultation from such practices, I think that is one of the best things any patient or any patient's family can do for their loved one.
Right. So you've lived your younger years here in Ludhiana and Jalandhar, right? So you've practiced a little bit in Ludhiana, gotten your MBBS from there. Um, I think Malwa has come out to be a belt that has a lot of cancer patients. There's also cancer train that goes out from Punjab, wherein like they're getting just a lot of people are going to get their treatment done. One reason that has been very closely associated with cancer in Punjab specifically is the polluted water. What are your thoughts on that? How big of a reason can polluted water be in terms of like people in Punjab getting cancer?
Yeah, I mean, I've heard of it, but I have honestly have not looked at that data with a lot of granularity. But in general speaking, pollutants perhaps are on the rise,
Hmm.
and including environmental as well as air pollution,
Hmm.
sound pollution, and there are other forms of pollution. And in general, pollutants can be one of the reasons which can contribute towards growing trends for cancer in general. That is
Hmm.
correct.
Hmm. And air purifiers have also become a practice. We're putting those inside, but then when
True,
we step out, we still are
true, true,
exposed to the.
true, true,
So, like, sometimes makes us feel very helpless, also. You know, how many options do we have as somebody who wants to live in their own homes?
true.
How do we kind of go about
Right, right,
factors that are not directly in our control?
right. Yes, I think in general the practices which I share with all friends, family, patients, their loved ones, and which I try to do it myself as well,
Hmm.
I feel is like some things which can help all of us are having or increasing fruits and vegetables in our diet. And there are some easy things we can do, like increasing fruit and vegetables, reducing ultra processed food, reducing excessive sugar consumption. I think cutting down on tobacco
Hmm.
practices, helping our obesity situation. I think
Hmm.
these are things which can like really help us.
Hmm.
One easy thing to do, easy thing means that it's not easy to do, but which someone can do even at their home is to increase physical activity.
Hmm.
For example, just using stairs, like
Hmm.
instead of using elevators.
Hmm.
So small little things, but all of these add up. I think,
Right.
and I feel if we build such health practices,
Hmm.
I feel we can make a positive impact on reducing cancer incidence and prevalence.
Have you ever been in India in October, November in the past 3, 4 years? Have you ever witnessed the level of smog that we are all inhaling
Yes, I
every
have.
day?
I have indeed visited in that time frame also, like a couple of times around Diwali as
Yeah,
well. And you're absolutely right, and that is quite worrisome.
right. And if we're doing all of these practices, but still the kind of air we are breathing is clearly
Yes,
like, in front of our eyes, it's
yes.
so polluted.
Uh,
So, like, do you see a way out as an expert from that?
Well, I'm not honestly. I'm not an air pollution expert, and I feel that there. I think that's a multivariable situation. There are a
Hmm.
lot of probably factors. Some, I
Hmm.
guess, political, which are
Hmm.
contributing to that.
Hmm.
But I believe government is trying to cut down on those
Stubble
practices.
burning
Yeah,
is
on those.
something that,
Yeah,
yeah,
yeah.
the
And I think
government
government is
has
very
done
actively
it.
working on
Yes.
that. So I think I applaud the government for that.
Yeah.
I think air purifiers, if we can use them,
Hmm.
and not everyone is able to, but if
Yeah.
we can use them, I believe they can be helpful to some extent.
Hmm.
But I think, but these are the some of the lingering
Hmm.
questions we do
Hmm.
need to attend to.
Right. Talking about three things that we are eating on a daily basis in our diet that are actually increasing our chances of getting cancer a lot. What are the top three things if you had to like rank them in that order?
Yeah, this is interesting. This puts me a little bit on a spot. I believe ultra processed food, I think that is not helping
So when
us.
you say ultra processed, anything that comes in a packaged form would be
Yes, yes,
ultra
yes, yes. I like
processed.
the industry standard definition of ultra
Yeah,
processed food. I think too much sugar intake is not helping us. I
right.
think in moderation, perhaps everything is okay, but
Hmm.
I think whenever there's excessive tobacco, alcohol, I mean all of these things, not enough roughage in the diet. Like
Right.
I think like when we eat on a daily basis, just consuming small amounts of, for example, cucumbers. I think
Hmm.
there are small little things we can do on a daily basis.
Yeah.
I
What are
think,
those three things that we can eat that can actually really reduce our chances also?
yeah, I think again,
Cucumber, you
yeah,
said would be one.
fruits and vegetables. I think increasing their portions in the diet. I think that's.
Any specific ones?
I think in general all all, I mean, one has to be careful about the sugar content. For example, if someone is diabetic, they have to see which foods they can consume. So it's tough to generalize.
Right.
But in green leafy vegetables,
Right.
in general, fruits, I think dates. I think there are some things which all of us we can do, which can help us from this
Right.
perspective.
Right, great. I think this was a very, very insightful conversation. In the very end, I have a list of a few things that we all commonly relate directly to cancer.
Sure.
I want to understand today from an expert whether
Okay.
there is science or scam behind that.
Okay.
So we'll do it in a fun science or scam
Sounds
section.
like a rapid fire.
Rapid fire.
Okay,
Yes, I'm
sounds
going
good.
to throw a
I hope I
few
can
terms.
survive.
Yes, you will. So you just say science where you think that there's science behind it directly being related to cancer,
Okay.
and scam where this has no studies, no scientifically
Okay.
backed
Okay.
data yet.
Okay.
So I'm just going to say a few
Sure, sure,
things.
sure.
All
So,
right.
so my disclaimer is, if I know, I will share. But if I'm not entirely aware of the data, because obviously I don't know everything, I
Right.
will just say I do not know.
That is fair.
Thank
That
you.
is fair.
Thank you.
That will help us maintain the credibility of it
Thank you.
also. So
Thank you.
I'm glad. Number one, obviously, is alcohol.
I think there is data which supports its role in cancer.
Science.
Absolutely. Data by data mean yes,
Yes,
science.
science.
Yes, yes.
Vaping.
Unknown, but perhaps less likely, but long-term data is awaited.
Okay.
Yes.
Diet Coke.
Uh, Unknown, but less likely. I think I would say it's less likely to be associated with cancer.
Than Coke.
Coke has sugar content. So I think that's a different story. And I think, again, in moderation, it's okay. But I think one has to be careful with excessive sugar consumption in general, because that also might be linked to obesity and other factors within the human body.
Right. Artificial sweeteners.
Not really great data pointing towards role in cancer.
So scam.
Well, in general means that perhaps they are okay to consume.
All
Artificial
right.
sweet,
All
yes,
right.
yes.
Protein powder.
Perhaps okay to consume. I think so. I think in my at least framework, I'm not aware of any direct association with cancer.
What about microwave? I read a story where somebody had suffered from cancer and they said the number one thing they're getting rid of is microwaves from their kitchen.
Yeah, this is interesting. I personally believe they are okay. So I would like to read a little bit more about it. I think if there is some data which I missed, which has some association, but I don't think I'm aware of it. I guess they are okay to use. Microwaves are okay to use.
All right. So
Yeah,
that's a scam then.
yeah. Okay. Okay.
What about sunscreens? They greatly reduce chances of us getting skin cancer. Is that science?
Well, I so greatly becomes that's like more like I would like to see some real data, like in what is the percentage association. But in generalizing, yeah, I think using sunscreens is a good strategy to reduce skin cancer. That I do believe in.
Okay,
Correct,
so
correct.
there's science behind
Yes.
it. What about plastic containers? We put our food in plastic containers. It's a very typical habit in India, and then we put it in the
True,
fridge and
true,
then consume it
true,
a couple of days
true.
later.
Uh, Long-term data is awaited.
Hmm.
My current inclination is it's unlikely to be associated. Just storing it is unlikely to be associated with cancer, but long-term data is awaited. But I'll be surprised if there is an association. So I think it's likely it's okay.
All right.
Yeah, till we are not heating foods
In
in plastic
plastic.
containers. So that's a
Right.
different story.
Right,
Yeah.
right, right. What about eggs? There was a recent study that they're
Eggs are very healthy. I
carcinogenic.
think eggs are very healthy. So no association whatsoever. Eggs are
No
very healthy.
association. Okay,
Yes.
fair. Chewing gums.
Yeah, I think chewing gums, the new age chewing gums tend to have the sweeteners.
Hmm.
But again, there is not really any data to support their association with cancer.
Hmm. What about palm oil?
Uh, Seed oils, in seed oils can have health issues, can be associated with health issues. I do not know honestly the direct association with cancer, but I do know that seed oils can be associated with some health issues. And is that indirectly associated with cancer? I will probably need to check. But I do believe I have read somewhere that there can be some minor amounts of perhaps precarcinogens in these.
Hmm.
But I'm not aware of direct data related to it.
There's not enough data on the
At
fact.
least for now,
Right.
I do not think so. But yeah, they can be associated with other health issues.
Right. Emulsifiers?
Unknown. I do not know.
Unknown.
Unknown.
Unknown. All right. I think that is it.
Okay.
One last thing that I want to talk about
Sure.
is the role that mindset plays in treatment. Have you ever seen cases where two people are there, same stage of cancer, one heals relatively faster, the other one eventually maybe even succumbs to cancer? Does that happen just with the difference in mindset of the two?
Yeah, very tough study to do from a practical perspective in terms of a scientific study. But from anecdotal experience and from what I have seen, what my colleagues have shared with me who do this on a daily basis, mindset can play a very important role. There is no doubt about it. And even for patients who keep a positive mindset, they have great family support, they're still trying to do well. Cancer is not an easy condition for anyone, including the patient's family. This is a challenging diagnosis, and people can go through hard times in a lot of different ways, even in terms of just going through the treatment, management, financial implications, family related implications in terms of testing for family members, and what the screening practices might be for family members in case there is a familial implication of disease. But I think keeping a positive mindset both for the patient as well as the patient's family is very important, and it can definitely make a difference. I think that's probably one of the most important things we have discussed today.
Hmm. And do you think stress actually plays a role in causing, like, increasing your chances of getting cancer?
Uh, Again, a tough study to do.
Hmm.
Can stress be one variable which contributes indirectly? Possibly, but I am not entirely aware of a great study which I can cite, which gives scientific evidence for this. So I think probably data is awaited.
All right. And when you talk about positive mindset, how can one keep a positive mindset when they're dealing with so much treatment
Right,
pain and, like,
right.
of course, like there's a
That
lot
is
of other
true. That is true.
factors.
That is true. I wish I had an easy answer. I feel a lot of it does end up being a personal journey and a family's journey for a patient with cancer.
Hmm.
I believe there are support networks which are now available. There are uh, trained clinical psychologists who can help
Hmm.
even the patient's family go through such conditions. I think there are some therapies. For example, there is now music therapy uh, which can help such scenarios. There are book clubs which patients can enroll in. Uh, and it might not be easy, but sometimes interacting with other patients who are undergoing through similar phases, that can be sometimes helpful.
Hmm.
So there's not one direct answer, but there are avenues which are available. Also, I do want to mention that a lot of large academic or tertiary cancer centers now have well-developed support services which can help the patients through journey as well as their families.
And as a friend or a family member, let's say you've just found out somebody in your family or a friend has cancer, what is the first thing that you should tell them that will eventually make them feel better, not worse?
Yeah, yeah, no, I think that's a very practical scenario actually, which can happen to sadly or
Hmm.
almost to anyone. I
Hmm.
think I feel a lot of instances the cancer diagnosis might be made by a primary care physician or a physician who might not ultimately treat the patient. So I feel getting the right clinical team for any patient is important, and that may or may not be the team or person who has diagnosed a patient with cancer.
Hmm.
I think appropriate medical workup for every patient who has cancer is very important, meaning what kind of tumor it is,
Hmm.
how aggressive it is, how much has it spread out,
Hmm.
what other testing is important. I think these are important questions for a patient and the patient's family.
Right.
Finding out does any patient's family member have an increase, like we were discussing
Hmm.
before, is there an increased incidence of cancers or tumors in a particular family, that can be important.
Hmm.
Then and I then again, and this is something I personally feel strongly about. I feel in general, if possible, getting a consultation or at least an opinion or option from perhaps the uh, the treating doctors or diagnosing doctors for oncology cases at large tertiary centers
Hmm.
can be helpful in these instances.
Right,
Does
right.
that answer your question?
Yes,
Okay.
yes, it does. It
Okay.
does. All right. Thank you so much, Dr. Rohit, for doing this with us. We had a great conversation and we really did debunk a lot of myths that we had around cancer. And our understanding is definitely way better than we started the podcast. So thank you so much for your time and we really appreciate.
Thank you so much for having me, and thanks for the great discussion. I think you got me also in a thinking mode. So thank you so
Yeah,
much. I appreciate that. Thank you very much. Thanks for
thank
having
you.
me.
Thank you so much.